to be big questions, especially around the accuracy of the information that's coming in from different countries on the continent right now in relation to the virus.
Yes, Cathy, I just got off a webinar about how Africa reports on COVID-19, and at the end of that webinar, felt we can really count our blessings. There were journalists from Nigeria on it, and you know that Nigeria has done very little testing. It's got a population of over 200 million people, and it's only done about 25,000 tests. Compare that to us, where we've got a quarter of that population, and we have done almost 400,000 tests. So in Kano State, there's a journalist on this webinar who reported on the state's reluctance to test. They don't want to test because they don't want many cases. And he did it by way of speaking to a health expert and got arrested. So if you compare that level of sort of lack of freedom to what we have in South Africa, you know, here we sort of argue about how should we decide who to test, and you know, are we able to trace all the people? We're not suppressing strategies. You know, I think it might be time for us to have another lecture, you know, like the one of Professor Abdul Karim, because people do feel there's some information that they don't have access to. Yeah. But I really think we can count our blessings in South Africa with media freedom.
Transparency is key when dealing with a situation like this. We've seen some reports of some countries where burials are taking place at night under the watch of authorities. Simply, again, some believe in a bid to hide the number of COVID-19 related deaths. So when it comes to accurate data then coming out of the continent, who should we rely on now?
Well, certainly there are deaths that are being hidden. Like, for instance, in Nigeria, in Kano State, again, there was discussed in this webinar that you know, deaths have really increased tenfold in Kano, but it's not allocated to COVID. It's just, you know, no one tests the people. But the information we get in South Africa, say the National Institute for Communicable Diseases, number of cases that are released each day, it might not be perfect, you know, it might not be perfect that it's released at the same time for the media each day, or, you know, with exactly the same data each day. But if you compare the level of accuracy of those tests to the kind of data that journalists in other African countries have to rely on, there is a huge difference. In other countries, you know, some journalists try to create the figures themselves because they feel it's not available. There are investigative journalism centers that have started to crowdsource figures. In South Africa, there are none of those challenges. I don't think our data is inaccurate. You know, there's a little bit of unhappiness about the fact that we don't have access to mathematical modeling studies that the government uses to make decisions. You know, I think there's legitimate, you know, push for that we want to know that data. But the kind of data that we push for access to is far more advanced than the basic data that many journalists in other African countries just don't have access to.
Mia, as much as we need to count our blessings, of course, we're not exempt from scrutiny. How do you think that the reportage in South Africa has evolved pre and during this period of lockdown? Because we're not quite post-lockdown yet.
Yes. Yes, no, I think there's definitely been a change. I think initially there was a lot of praise in the media because it was so different from HIV. You know, the journalists were so relieved that we had an evidence-based strategy and that they were seen as partners. But now the media has definitely become more critical because there's so much more to criticize. We've now reached a stage where tenders are being issued, and we've seen this week in the Daily Maverick that there was an e-learning tender that was awarded to Iqbal Surf's company, AU Technology, and that there seems to be irregularities around that. So there are more opportunities for sort of traditional investigative journalism now. But something that I find very interesting in the COVID reporting of the media is I've never seen as many op-eds. You know, you get so many scientists who write op-eds, and often they say things that are really not that different from government, but it's framed in a controversial way. And I think we sometimes forget that scientists are a little bit like journalists. They also have egos and want to be heard, and that if they're not being heard, they're going to use the media to make their views heard.
All right.